You didn't train for this. When someone you love receives a cancer diagnosis, you are suddenly thrust into the role of caregiver, expected to manage a complex new medical reality overnight. If you feel completely overwhelmed, isolated, or unsure of what to do next, you are having a normal reaction to an enormous responsibility. The most effective way to regain your footing is to build a personalized, physical caregiver action plan. We are going to map out a balanced daily schedule that organizes your household duties, coordinates medical needs, and carves out necessary time for your own well-being. To get started, grab a blank notebook or a weekly planner. By translating all those swirling, abstract anxieties into a concrete written strategy, you shift from simply reacting to the crisis to actively managing it. Step 1 is the brain dump. Write down every single daily requirement you can think of, from grocery shopping and doing laundry to picking up prescriptions. Divide your list into 2 columns, household tasks on the left, medical on the right. Then move these items into a daily schedule template based on the patient's energy cycles. Place high-effort tasks like bathing or traveling strictly within those peak windows. Next, explicitly block out short periods for rest so they don't disrupt nighttime sleep. Then, identify at least 3 tasks you can delegate to friends or neighbors to avoid overscheduling yourself. A successful schedule does not mean you are doing all the work yourself. It means you have built a sustainable system that explicitly relies on external help. Step 3 is establishing a strict protocol for medical care and tracking side effects. Keep a dedicated log of red flag indicators. You need to monitor for specific warning signs, such as an unexpected fever, severe fatigue, or a drop in white blood cell counts. Alongside that log, create a quick reference emergency sheet. Write down exactly who on the cancer care team you should contact after hours, on weekends, and during holidays. Step 4 is drafting a communication strategy to help you navigate the emotional complexities of a cancer diagnosis. When the patient isn't ready to talk, do not force the conversation. Often, a quiet physical presence is the most effective support. When you have discussions with the doctors, information overload is guaranteed. Always write down a list of questions before walking into the oncology clinic. By formalizing your emergency contacts and recognizing the limits of communication, you prevent panic. This ensures your loved one feels supported rather than managed. Step 5 requires scheduling mandatory, non-negotiable personal time into your routine. It is common to feel guilty for stepping away, but you must reframe self-care. It is a critical requirement to prevent your own burnout. Take time to eat balanced meals, go for a short daily walk, or utilize sitter companion services for respite. Step 6 is actively identifying your support system and building a village. Map out specific organizations in your community. Groups like the American Cancer Society provide immense resources that can directly combat the isolation of caregiving. For example, their Cancer Survivors Network offers a safe online space where you can share practical advice and find emotional backing from peers who understand. Cancer treatment is a long timeline. Accepting help and enforcing boundaries are the only ways to sustain your health across that journey. Look at what you have built. You have taken a state of total chaos and organized it into a structured, manageable plan. You now have a balanced daily schedule, a dedicated medical folder with your emergency contacts, and a mapped-out support network ready to assist you. You won't execute this perfectly every single time, and that is completely fine. The objective is simply to take the process one manageable day at a time. For more tools, head over to cancer.org to access downloadable question checklists, helpful interactive guides, and caregiver support videos. Executing this action plan gives you back control over your environment. It ensures that both you and your loved one receive the exact care you need.